Let's continue to build on our discussion of intraocular lenses by adding more features. We had discussed correcting astigmatism. Moving forward into the new advanced technology lenses, it is always assumed that we will correct your astigmatism. These advanced technology lenses aim to solve the problem of presbyopia, or the limitation of your range of vision. These lenses will offer you range of vision on top of astigmatism correction. Think of a multifocal intraocular lens like your smartphone camera. It has 3 lenses built into one device. My smartphone camera has 3 lenses, one for distance, one for intermediate, and one for near. Similarly, all 3 lenses will be built into your one intraocular lens. The multifocal lens has concentric rings built into the optic to diffract or bend light to focus it for multiple distances onto the retina. Because of these rings, patients will often notice halos, particularly right after surgery. However, these halos will be less prominent as the brain learns and adapts to this technology. Most patients will not notice the halos after a few weeks of neuroadaptations, and the transitions between distances will become seamless. The learning curve is much lower than using progressives and usually well tolerated. It is a well-studied fact that some personality types may be better suited to using these lenses, and other personality types may find it hard to adjust to these types of lenses. During your consultation, we may ask some general questions about your personality for the purpose of helping you choose the right lens. There are 2 brands of multifocal intraocular lenses currently in the United States, the PanOptix by Alcon and the Synergy by Johnson & Johnson. For all intents and purposes, these lenses are equal in performance. The multifocal diffractive intraocular lens requires the patient to have a healthy eye. It would not be a good idea to use this technology on an eye that has a corneal disease, glaucoma, macular degeneration, or a significant extraretinal membrane, to name a few. It is okay to use this lens if you have had prior refractive surgeries. In fact, when we are off target for these lenses, we will often perform a touch-up surgery with LASIK or PRK. The drawback for the multifocal lens is most often the effect of halos around bright lights in the dark night. Halos look like this. A small handful of patients may be intolerant to this. If after 2 to 3 months of failed neuroadaptation, then we can consider performing a lens exchange surgery where the multifocal lens will be removed and another type of lens will be implanted in its place. This procedure is safe and usually takes 10 minutes to perform with a short recovery time, much like cataract surgery. Another drawback is diminished contrast sensitivity. As these lenses take the same amount of light to form 3 clear images, each image will have slightly less contrast. Usually this is apparent when the multifocal lens user is having a candlelit dinner and notices she cannot see the menu as well as if in a brightly lit room. There are a few scenarios that a user would notice this effect. The newest generation of multifocal lenses have been improved to diminish the halo side effect profile, and their contrast sensitivity now matches some of the current versions of monofocal lenses. To summarize, the multifocal lens is great for healthy eyes to achieve glasses independence at all distances, near, intermediate, and far. They can produce halos and can have diminished contrast sensitivity that can make it harder to see in dim lighting. This is the lens to choose if you value range of vision and to be independent of glasses. If you are not adapting to this lens, we will help you change the lens to a different class of lens usually to a monofocal lens or monofocal toric lens, at no additional charge.